This is Rick Aristogeta with Pharmacy Specialist. Today I'll be demonstrating to you how to infuse your IV antibiotic using the Mini-Bag Plus system. The first step will be cleaning off a work area. You can simply do this by wiping down the surface that you're going to be working on. Next, you're going to want to thoroughly wash your hands with soap and water. Now we're going to prepare the work area by laying out your SASH method mat that will be provided to you and gathering all the necessary supplies listed on the mat. Make sure that you get out your cheat sheets for doing the infusion. We will provide these to you with Pharmacy Specialist. Next, with the supplies that we're going to be utilizing, we're going to need hand sanitizer, gloves, the IV antibiotic, 2 sodium chloride flushes, a heparin flush, and a multitude of alcohol prep pads. You should use only 4, but I always tell patients to get out extra just in case. The last step will be utilizing the swab cap. Also note, the Dialaflow tubing is not connected to the antibiotic yet. We must reconstitute the antibiotic, which will be the next step, before we hook up our Dialaflow tubing. Now we will begin the reconstitution or mixing of the IV antibiotic. If you look at your instruction sheet, you will notice that when the bags are supplied to you, the first 3 steps have already occurred. By the pharmacy, we connect the vials of medication to the Mini-Bag Plus system. You will also notice that this bag is a sample bag and therefore is no label. Your bags, when they're supplied to you, will have a label affixed to them with your name, the name of the drug, the duration of the therapy, as well as the time it will take to infuse the antibiotic, as well as the use-by date, which is the last day that the antibiotic can be used. Please verify the label before infusing the antibiotic. Since we have verified our label and made sure the medication and all the information is correct, the next step, or step 4 on our cheat sheet, is to break the seal, which is right here in between the vial of antibiotic and the Mini-Bag Plus. Basically, to break the seal, what we're going to do is bend it in half a few times and separate the 2 from each other. Here we go. Now that the seal has been broken, what we're going to do is hold the bag upright and squeeze the bag, which in turn will add fluid into the vial. Let's go up here, just like this. See how I'm squeezing the medication in, or the solution, excuse me, into the medication. You want to fill the vial up with about halfway on the solution. Right there should be good. The next step is we're going to swirl the vial, getting it mixing the antibiotic. You'll see here. You don't want to be too aggressive with the swirl. We don't want to create bubbles in the vial. It makes it a little bit harder for it to actually mix. Now that the medication has been mixed completely and dissolved completely, the next step is getting the medication or the antibiotic back into this Mini-Bag Plus. As you can see, there's air in this bag, and what we're going to want to do is lift the vial up and squeeze the bag to push the air into the vial, as you can see here. By doing this, the antibiotic is slowly trickling into the rest of the solution in the mini bag plus. Once it gets to the bottom, you'll hear it. There we go. We've got it in. Now the medication is mixed inside the bag of the mini bag plus. After we have reconstituted or mixed the antibiotic, the next step is going to be getting your cheat sheet out for the gravity infusion and hand sanitize and put on gloves. You're going to want to hand sanitize for a minimum of 15 seconds, making sure that you get in between your fingers, and then put on your gloves. The next step, we're going to want to get out our IV drip tubing or gravity flow tubing, Dialaflow tubing, that's what this is called. These are sealed. I have one out already that we're going to use as a demo. Right here. Stretch this out. First step of the procedure is spiking the bag. That is basically connecting this piece to the bag of medication. You're going to notice on the bag of medication there is a IV port, this little blue thing. It is a stretch port, so basically you're going to pull on it until it pops off. Throw that off to the side. Pull the cap off of your spike. Drop that. And then connect the two by pushing the spike in and twisting as it goes in. Once it bottoms out or gets to the right here, you have connected the Dialaflow tubing. The next step is going to be getting the medication down into the tubing. This, with a bubble chamber, is how we're going to squeeze it and get the medication into it. Just like that. Get it in about halfway. Now, we're going to stick the bag of medication on our IV pole, which will be supplied to you by pharmacy specialists. Now, it's a good idea to possibly have a cup nearby so that you can fill the tubing or prime the tubing, which basically means gets the medication all the way down the line to where it ends up at the very end of the tubing to where it's going to connect to your PICC line. So, to do this, we're going to open the Dialaflow to where it says open. So it says off currently, right here. Let's switch it to on, which is going to be this direction, all the way. As you can see, fluid starts to flow already coming into here. The next step is get the end of your line here, place it over the cup, and grab your slide clamp and slide it open. Now, it will come through here pretty quickly once it starts flowing. And once it gets to the very end, you'll see it. It's running, running, running. Starts dripping. You want to clamp it off. Once you've clamped it, medication is run to the very end. You're ready to go. The next step is going to be utilizing your sodium chloride flushes, heparin flushes, and alcohol prep pads to clean your PICC line. Let's set this down here. We're going to grab an alcohol prep pad, remove your cap from the PICC line, tear it right down the middle, grab your alcohol prep pad, and scrub the hub for a minimum of 15 seconds. 15 seconds is the ABC song, the happy birthday song, or you can just look at a clock and do it for 15 seconds. The pressure you place on it and the alcohol that is in the prep pad is what cleans the end of the hub. I always tell my patients 5 on the side, 10 on the end, because that's where the actual connection occurs. 5 on the side, 10 on the end. Once you've done that, next piece is going to be connecting your sodium chloride flush, which is basically popping it out of the bag. Removing the air bubble, which to do that, all you're going to do is open the cap just a little, pull down on the plunger, and then push that air bubble that's in there out. Get that up there. You can actually remove the cap. See it a little bit better. Now I'm going to drop this cap and connect to the PICC line. I use the V technique, which is basically shape of a V, tilt the sodium chloride flush over, bottom it out where it won't move any forward, and then twist away from you, connecting the sodium chloride flush injection. Next step is going to be flushing through with the sodium chloride. All you want to do is you want to do a pulsating technique, flushing the sodium chloride almost all the way down to the end. I like to stop the plunger around 2. Disconnect, throw that off to the side. Now we're going to connect the antibiotic to the end of the PICC line. As long as you don't touch anything, you should be good to scrub the hub one more time. "15 seconds. 5 on the sides, 10 on the end. Connect the antibiotic to it by pulling the cap. Using the V procedure again, tilting it over, pressing it in until it bottoms out, and twisting away from you. Once we've made the connection to our PICC line, the next step is we're going to go back to our Dilaflow and look at our label on the antibiotic and see what rate it needs to be infusing. I'm using 200 per mLs, per hour. So I'm just going to roll it back to here. Okay. Once you've done that, we're going to go to our green slide clamp. Open the clamp. Can slide it into this little slot at the other end. It looks like almost an Oscar, and you put the tubing in the head of the Oscar. And then you let it run for the amount time that is stated on your bag of IV antibiotic. Now that your infusion is complete, we're going to want to clamp off our green slide clamp, turn off our Dilaflow, so go from our 200 where we were to off. Okay. Now we'll go to our PICC line and disconnect. Simply holding on to the microclave hub, twist, it will pop off. Set that off to the side. The next step is going to be utilizing another alcohol prep pad by tearing right down the middle, popping that alcohol prep pad out, holding on to the hub, 5 on the side, 10 on the end. Grabbing your next sodium chloride injection flush, popping it out of the bag here. Sometimes they don't want to come off the plastic. Go ahead and pull your cap. You'll notice that air bubble's in there. Every one of the syringes is going to have an air bubble, so we've got to get rid of that air. So draw back, and then notice the air bubble. Push the air bubble out. Till it comes out. Using the V method again. Push in till it bottoms out. Twist away from you and flush in once again using a pulsating method. Once you get down to about 2 on the rubber plunger, disconnect, throw that off to the side. Alcohol prep pad one more time. Five on the sides. 10 on the end. Grab our heparin flush, which basically is the last step in keeping that line patent or flowing. We utilize this just enough heparin to make sure that that PICC line doesn't clot off. You'll also note that the heparin is a different color than the saline. Saline caps are white. Heparin caps are either going to be blue or yellow, depending on the type of heparin needed for your particular line. Same thing like the saline, we want to get rid of that air bubble, so we'll pull back on the plunger and back up until the air comes out. Once we've got it out, V method, get it bottomed out, twist away, flush in. Same thing with the heparin. Once you get down to about 2, that's all you really need. Most PICC lines are going to only need anywhere from 1 to maybe 2 mLs of any of the solutions. Once that's cleared, the last step is going to be attaching your swab cap. Now, with the swab cap, you don't have to scrub the hub because it actually has alcohol in it, which you will find out when you push the cap on. These are pretty tight, so you have to push and twist. When you do, as you can see on my glove, some of the alcohol comes off. Pull your cap, and that's it. This concludes our tutorial on the Mini Bag Plus system utilizing the Dilaflow tubing. If you have any questions or concerns, Pharmacy Specialist is open 24/7. Just give us a call and we'll help you with all of your needs.